Hello, this is Neil Baum from New Orleans, Louisiana, and I'd like to take just a few minutes to speak with you about the concept of artificial intelligence. I do not promote myself as a medical futurist. However, I have become very interested in the concept of artificial intelligence and its role it is going to take in the future of healthcare. In this video, I'll define what artificial intelligence is. I'll give you some current examples, and then I will explain to you why artificial intelligence is not going to replace the contemporary physician. I believe artificial intelligence is going to be a game changer of the 21st century. It is in its infancy right now, and there are very few early adapters to artificial intelligence, but I believe it is going to assume tsunami-like proportions in the very near future. So what are some current examples of artificial intelligence in the clinical sector of healthcare? Artificial intelligence is now able to read mammograms, and the studies indicated that they are as good as or even exceed the interpretation of radiologists. Artificial intelligence is also going to be able to screen diabetic patients for diabetic retinopathy. Artificial intelligence is currently able to read pathology slides. And an example is that they can be used for screening for skin cancer. Compare that the average dermatology in his or her lifetime may look at approximately 12,000 lesions. However, artificial intelligence can easily look at over 250,000 lesions and have the accuracy of recommending which patients should be recommended for a biopsy of a skin lesion. Also, artificial intelligence can be used to uncover the disparity between whites and non-whites regarding healthcare. This was demonstrated with COVID-19, where artificial intelligence was able to identify the non-whites had a greater incidence of COVID-19 and greater complications, hospitalizations, and even death compared to non-whites. Artificial intelligence is going to be able to access and summarize millions of similar cases for a doctor and will be able to use that information in guiding a patient regarding management and treatment. Some non-clinical examples currently of artificial intelligence is that it is able to analyze large data sets of information regarding patients' demographics and insurance information. It can collate electronic medical records data. Artificial intelligence is also useful for data entry into the electronic medical record. And as a result, the doctor doesn't have to be looking at a computer, but can focus on his or her interaction with the patient. I've told you what AI can do, but what will AI not be able to do? AI at the present time and not in the foreseeable future will not be able to replace the physician by interpreting data and algorithms. Patients do not want to be treated by a machine or an algorithm. They want to be evaluated and touched and examined when possible by a caring physician. Artificial intelligence cannot replace the empathy and understanding with the patient. The AI is not going to be able to hold the hand of a patient and provide that compassion and understanding that patients so much care for and seek out. As a result, there'll be a new role for the physician. The physician will now function as both nurse and medical assistant, as social worker, and even as psychiatrist. So what is the future of artificial intelligence in our relationship with our patients? The reality is middle-aged and older physicians are retiring earlier. It is estimated that we're going to need more than 125,000 additional physicians by the year 2030. We are increasing the number of baby boomers. There are 10,000 additional baby boomers on the rolls of insurance companies and Medicare insurance each day. But there is no significant increase in medical school positions. It is also estimated that by the year 2026, there's going to be over 1 million new jobs in healthcare. An example of the use of artificial intelligence and in the management of patients are patients who have been recently discharged from the hospital are going to be managed by medical assistants or what has been defined as grand aides. These are individuals who are trained to go to the patient's home and evaluate the patients regarding taking their medications, regarding their weight, regarding their diet, with the result being, and has been tested to date, has reduced readmission rates for patients with chronic diseases. It has improved outcomes, and as you can imagine, has reduced the cost of care. Artificial intelligence is going to improve access to care to those in underserved regions, like those in rural communities. As a result of this advantage of artificial intelligence, the future doctor is going to have to be trained and have enhanced communication skills. The opportunity for artificial intelligence to assume routine automation that is going to be so helpful, such as answering requests in the inbox, be able to refill medications with authorization from the physician, and also to create notifications for patients about their follow-up care. We are going to see improved drug compliance as a result of the use of artificial intelligence. Today, over 70% of patients who are on chronic medications are not refilling their medications, not taking their medications properly, and this provides a role for the use of wearables and Alexa in the home to remind patients to take their medication on a daily basis. And if they don't take the medication, they are given permission by the patient to contact the caregiver or the physician. Another example of the future of artificial intelligence, the problem of C. difficile infections accounts for over $5 billion a year cost of managing this condition. As a result, artificial intelligence will be able to identify patients who are at risk and those patients who are indeed candidates for antibiotics, so they don't put patients automatically on antibiotics and have them respond with a C. difficile infection. Also, artificial intelligence will be able to identify patients who may be able to respond to immunotherapy and who will benefit by immunotherapy as a result of screening and identifying these patients with artificial intelligence. The point that I want to make is that artificial intelligence will be an adjunct to the electronic health record and as a risk predictor. At the present time, care is episodic, and that is we provide care for our patients when we see the patient in an office visit or a virtual visit. And at the present time, there is no significant monitoring of patients, especially those patients with chronic conditions. This will provide a role for wearables and the use of monitoring with a collection of data by the wearables, and will be able, for example, to record patients' heart rhythm on a 24/7 basis. One of the obstacles will be that patients may not be comfortable sharing this data. There is a significant increase in the use of smartphones to manage patients. Those examples in the specialties of dermatology, as I've told you about screening for skin lesions, ophthalmology in detecting retinopathy, even retinopathy in premature infants, and is also going to be used for mental health screening and rehab. In summary, artificial intelligence will serve as an assistant or an adjunct for physicians. It will increase our available knowledge that we can provide for physician care, and it will offer the best treatment options for our patients. As a result, doctors can now focus on empathy, compassion, and understanding. It is not the purpose, nor is the intention of artificial intelligence replacing the physician. Well, I hope you have understood that patients are interested in caring in addition to the concept of curing. And I hope you have found this brief video on the future of artificial intelligence to care and provide diagnosis and management for your patients. If you have any comments or suggestions about artificial intelligence in your practice, kindly let me hear from you at the email address shown on this last slide. Thank you.